Good afternoon, everyone. Alan Harris here at the Seminole County Emergency Operation. Today is May the 15th at 12 o'clock. As we do every Tuesday and Friday, we are going to give you an update on what's going on here in the county related to COVID-19. We have had a little bit of an uptick in the number of positive cases. We are now at 430 positive cases since the beginning of this event. We have increased our testing quite a bit over the last couple of weeks. So before our drive-through testing, we were sitting around 3,000. We have now tested 12,487 individuals with results back. So there's still some that are out right now, still at the laboratory, and we're waiting for results back from those. But we have received back 12,487. Of those tested, we have a positive percentage of 3.79%. So it's increased just a little bit, but not very much, but certainly down over about 3 weeks ago when we only had 3,000 people tested. That's primarily, again, because we were testing only people that were symptomatic, and we now are testing anyone that wants a test here in the county. We currently are, there is antibody testing taking place in the county. And right now in the county, we've had over 1,157 individuals tested for antibodies in the community. There's a whole list of antibody testing on our website. But if you would like to go to one of these locations, you can get an antibody test. The Orange County Convention Center is currently doing antibody testing for first responder and healthcare workers. So if you're a healthcare worker or a first responder listening to me today, you can go down to the Orange County Convention Center, and there are 80 antibody tests each day that are allotted specifically for this particular community, as well as you can go to a private healthcare provider. And here in Seminole County, that is the Urgent Care of Longwood, Stages of Life Medical Institute, LabCorp, and Quest. Now, for LabCorp and Quest, of course, you have to have a prescription to get the antibody testing. If you don't have a primary physician or you just want to go directly to LabCorp, you can go directly to LabCorp and get their primary physician through maybe a telemedicine or something like that to write you a prescription, and then you can get the antibody test there. Tomorrow, May the 16th, we will be doing a pop-up test site. That is from 10 a.m. to 2 p.m. We want to thank our partners with the American Muscle Clinic, Bueno Pharmacy, and the Florida Department of Health. They're going to be co-sponsoring the event and doing the testing. Again, that's tomorrow from 10 a.m. to 2 p.m. And that's at the Iglesia Presbyterian. It is at 6971 Red Bug Lake Road in Oviedo. We're going to be doing these pop-up test sites for the next few Saturdays. So this one is in Oviedo. The following Saturday, we're going to be in Altamont Springs at the St. Mary Magdalene Church there in Altamont Springs. And the following Saturday, we're going to be at the Iglesia Cristiano Church, and that is on Dog Track Road in Longwood. So still doing some testing out there. And of course, there is testing available. If you want to get a COVID-19 test, you can certainly go to any urgent care, any standalone emergency room, as well as any of the hospitals. And then we have just heard that CVS actually is going to be doing COVID-19 testing in Altamont Springs. So now the pharmacies are starting to do COVID-19 testing. We did close down our drive-through test site today because we were expecting some rain. We were actually kind of hoping for some rain. I'm looking out the window over there, and there are some clouds in the sky, and we certainly still hope that we get a little bit of rain today. Our KDBI, which is our fire index, is very, very high right now. It's very dry, low humidity, and of course the winds are popping up. So this is not what we like to see with wildfire season on us. So we're hoping we get a little rain to bring that index down. If we don't get the index come down, if we don't have the rain over the weekend, we potentially could be looking at issuing a burn ban by Monday morning. So stay tuned to that. Again, hopefully we will get a little bit of rain today and we can bring that down. Anna, hello, Anna. How you doing? I see Ed is on there. David, it's good to see you logging on today. Appreciate you coming by on Wednesday. Jazz, good to see you as well. All of y'all. Anna, so Anna asked, is it safe or not? And I assume that means, is it safe or not in the community? So it's a great question. We're getting a lot of those types of questions. What can I do? How can I stay safe? Things like that. Each individual person is going to have to make a judgment call on what they want to do based on the risk of themselves and those they love. And what I mean by that, those they love that they may live with or they're going to visit or things like that. So as I had mentioned in the last Facebook Live, the individual that is single, that lives alone, in good health, young man or woman, that doesn't live with anyone that's elderly, hangs out with the friends and stuff like that, but that's pretty much it. They're going to act very differently. Their risk is very different than a family with an autistic or an asthmatic child or something like that. So someone that's taking care of an elderly person at home. Now, it's always best for us all to take care, because we're going to end up in a public setting where we're together. Whether it's a grocery store or a hardware store or whatever. So you're going to have to make judgment calls for your own risk and what you want to do. So Anna, what I would say is you're going to have to assess your risk. Things are much better now. The numbers have gone down considerably. People have been social distancing, which is good. We have seen the spread slow down dramatically here in the county. The numbers are dropping dramatically over the last 2 weeks. Our hospital stays have decreased. Right now in the hospital, we have 3 individuals in the hospital. That's the lowest we've seen it in quite a while. So the social distancing did work. The things that we put in place did slow it down. 5-6 weeks ago, we were seeing an incredible number continually added each and every day, and we're not seeing that right now. So you're going to have to make a judgment call on what you want to do, what's safe for you and your family. And for me personally, I go into a place and there's not anyone wearing masks. I turn around and leave. It's just not. For my own risk, that's not something I'm going to do. But each individual person has to determine what they want to do. Denise asked, what's the percentage positive for antibodies? This is a great question. We actually don't get that statistics from the Florida Department of Health, but it is a good question. But we have seen, again, the 1,157 individuals that have been tested, but we're not getting the test results back for positive. I'll see if we can get that number, but I'm not. We haven't seen that percentage number yet. Are any children positive? Under 18. Yes, our youngest child that was positive was 6 months old. So we have had a 6-month-old. I know we've had a 1-year-old. We've had quite a few folks that have been under 18 years old. So absolutely we have had younger people. All of our deaths have been over 50, I believe, in the county. I think, yeah, that's definitely right. But we have certainly seen younger people that have had COVID-19. Let's see. Alana asked, can neighborhood pools reopen? Alana, we never close neighborhood pools. It is up to the pool owner if they want to open the pools or not. We've had a few people call into the EOC. I'm smiling because they said, are the Seminole County pools open? Well, Lake Monroe, Lake Jessup, and Lake Harney are all open. Those are the only pools that Seminole County government, we don't own them, but that's the only, we don't have pools. So we've never closed a pool. But we know that people have closed pools. If you use a city pool, you're going to need to contact that particular city to determine if they're going to open their pool, and then it would be up to the private owner of the pool. So if it's an apartment complex or something like that, or a homeowners association, they're going to need to make that determination. Once they make that determination, of course, we, along with the CDC and the White House medical team, they've all provided guidance on social distancing, keeping 6 feet away from each other, things like that. Common surfaces, the things we've talked about for a long, long time. Touching common surfaces, touching the eyes, things like that. Those are all ways that we can transfer this particular virus. So we need to be careful whenever we do, didn't say but if it was a homeowner association or whatever, when they do open the pool, make sure that you take the proper safety precautions for you and your family. Karen asks, how many in Sanford have had COVID-19? That is a good question. Karen, let me try to look up that number real quick for you here. And while they're doing that, let me see if I can see another question. I'll try to do two things here at once. Mindy asks, nursing homes, when can visitors come back inside? So that probably will be discussed over the next couple of press conferences with the governor and the determination if it would be safe for individuals to start to come into the nursing homes. I know right now we have a few nursing homes and assisted living facilities that have COVID-19 positive individuals inside. We're trying to limit we, healthcare providers, emergency management, working with ALF and nursing home administrators are trying to protect our most vulnerable populations. So we're trying to minimize the amount of risk or possibility of risk of individuals going in with COVID-19. So at this particular point, we are not encouraging visitors at nursing homes and assisted living facilities, and the state has actually made that a requirement through ACA, which is the administrator that does the healthcare regulations and licensing. So I know as soon as it's safe to do so, they will. But right now, I can tell you we have a few ALFs and nursing homes that have COVID-19 positive individuals inside, and we want to protect them as best we can. Kelly asked, are grocery stores at 50% capacity? Oh, good. Thank you very much. So since the onset, we've had 57 individuals in Sanford with COVID-19. So I want to thank whoever, let's see who, Catherine. Yeah. Thank you, Catherine. I appreciate that. She ran that over to us. So thank you very much. So 57 individuals in Sanford since the onset have had COVID-19. Kelly asked, are grocery stores at 50% capacity? Yes, they are. 50% capacity based on their fire code. So that's what they should be monitoring. Most all grocery stores, from what we've heard, are doing a great job monitoring things like that. Blaine asked, nursing home statuses, positive counts, ALFs, how many are being tested? So it's a good question. We actually just got off a phone call with the state of Florida in relation to this. So we are doing testing in ALFs and nursing homes. We have 17 currently on the list. That doesn't mean 17 have positive COVID-19 patients. I want to be clear about that. That means that we're testing inside of 17 facilities. So, and we're doing those at the administrator's request, and they're just trying to make sure that all their residents are secure, their staff is secure, things like that. I did say that some did have positive COVID-19. We are definitely doing testing in those facilities as well, but administrators can also just determine that they want to test just to make certain that no one is asymptomatic in there, things like that. So they are doing that. You can get a list from the Florida Department of Health. So if you Google Florida Department of Health COVID-19, you can get a list of all the assisted living facilities and nursing homes that have had COVID-19 patients in the entire state of Florida and broken down into each county. Haley asked, what is being done for low-income minorities to make testing available? Haley, we did pop-up sites in targeted communities, targeted low-income communities. We did that over a 3-week period. We're continuing to do outreach to those communities. We actually have a healthcare permanent site being placed in one of those communities. We're in the process of doing one in another one of those communities. So a lot of outreach in those particular communities. We understand that some of those individuals are they need transportation and things like that. So that's why we did the pop-up sites directly in their community, so they could actually just walk over to get a test if they wanted to. And we're continuing that issue. Cindy asks, how can we help our community? So you can help if you would like through donations. And I'll mention some of the nonprofits that we've been working with. Harvest Time International, the Sharing Center, Meals on Wheels, those all have provided meals and food to individuals that are isolated and quarantined in their houses. So we certainly appreciate them. The foundation at the Seminole County Public Schools has provided school supplies to children that are COVID-19 positive, that are doing schoolwork at home, and or children that are stuck in their home. Maybe there's someone else in the household that has COVID-19 and they can't leave the household to get school supplies. So they have also provided. So the foundation for the school board has provided a lot of those supplies. So that may be, if you want to give, that may be a way to give back to the community, certainly. And they've done some incredible work here in the county. Our health partners, our nonprofit health partners, True Health and Allied Health, as well as the American Muslim Medical Clinic, which is going to be doing the pop-up site on Saturday, they also have done an incredible amount of work. So one of those facilities, one of those nonprofits would be a great way to give back to the community. Renee asked, when can parks reopen? Parks are open, Renee. You can go to any Seminole County park. We have never closed a single park here in the county. There may be some city parks that are closed, but none of the Seminole County parks have ever been closed. Now, we have closed the playground areas. Those maintain closure, and that is business number one, hard to social distance on the playground. Number two, the state of Florida's executive order 20-112, which the governor issued, it talks specifically about childcare. While it's specific to childcare in museums and libraries, we also consider, playgrounds. It's very challenging, and as I mentioned just a little while ago, this is the virus doesn't skip over the young. Again, our youngest individual, COVID-19, 6 months old. Again, you're going to have to make the determination if you want to take your child to another type of playground. Seminole County, though, our playgrounds are temporarily closed. Leisure Services is monitoring that. We're looking at CDC guidance and things like that. As soon as they decide that it is safe, and as soon as our medical doctors are telling us that it's safe, then we will certainly reopen that. Crystal asked a very similar question. When will the city playgrounds? So the city playgrounds in the county, the city and the county are two different entities. So each city, Crystal, each city is going to have to make their own determination. So Altamont Springs also, if you look at our heat map, Altamont Springs may make a different decision than Sanford, which may make a different decision than Oviedo. And that is based on the information they're receiving. That's based on their medical doctors' opinions and things like that. So they're going to look at their data, and they're going to make the decision for public health of their particular community. At this particular point, though, I mean, if you're a parent, we talked about this the last time. I was shocked how many people had croquet sets. I'm pretty happy about that. It's pretty cool. It was fun to see. There's so many activities as a family that we could do out in a park without having to go to a playground. So why we would want to go and put our children in common surfaces in close proximity when we know there's a virus out there, I don't know. So if that's something you want to do, that's something you want to do. That's something you're going to have to make a decision about. But at this particular point, if there may be playgrounds available, and certainly if there are, if you want to take your child there, you can take your child there. Mike asked, please explain active cases versus the cumulative count. So on our dashboards, if you go to prepareseminole.org, on the dashboard at the top of the Prepare Seminole website on the COVID-19, you can click on the dashboard. And when you click on the dashboard, you're going to see, and I'm looking over at the screen right now, you're going to see the total number of confirmed residential and confirmed non-residential. And we've talked about that in previous Facebook Lives. So the total there minus the recovered, which is underneath that, is the number of active cases currently in the county. So all you got to do is subtract those two numbers, and you find out what is the current cases of COVID-19 in the community. We look at the top number because we're tallying what we've seen so far. So that's just a total of what we've responded to so far. So just subtract those two. Martina asks, gym and health studios, are they reopening soon? We're supposed to hear something from the governor pretty soon here, so we're all excited to hear about that. Lou asks, when is phase 2 starting? Well, if you read the governor's state plan for reopening, gyms and health clubs were actually in phase 1. So we're not even really fully in phase 1 at this point. And phase 1 also, retail and restaurants on his own plan was at 50%. We're at 25%. So I think what we're going to see maybe is a phase 1B, and we actually get into full phase 1. So we're technically not fully in phase 1 if you read his plan. And you can download his plan. Just go to Safe Smart Step by Step. You can just Google that plan, and you can download the plan and read through the plan and what all in phase 1 actually entails. But at this point, I don't know if he would go to a modified phase 2 with some gyms. So we don't know, really, quite frankly. So can you please tell us that there will be no hurricanes, Carrie? I wish I could tell you that. In fact, that would make my last week very, very a little bit easier, I should say. And it makes my next week very, very much easier if I did not have to plan for hurricanes. But I have an incredible amount of meetings and work that we have to do to get ready for hurricane season, plus COVID-19 on top of that. So we're pushing out some of the first information today to our first responders. We're getting our shelter plans set next Monday morning. We're looking at enhanced cleaning and temperature checks and triage inside of the emergency shelters prior to the emergency shelters. What we're going to require as individuals go to an emergency shelter, will they be required to wear a mask? Things like that while they're in the shelters. How are we going to space people out? All those questions still have to be answered. And we're gonna seek medical doctors' opinions as we make those plans. So we've got some of the plans already written, and some of them, some of those we're working on right now. Sherry asked, are any COVID patients currently at the Oviedo Medical Center? We only have 3, and actually I don't have the list of where they are. So we only currently have 3 in any hospital system whatsoever, and that includes all of Advent Health, all of Orlando, and all of HCA. So I don't know exactly which facilities they are in currently, but there are only 3 in Seminole County right now in the shelters. Linda asked, what time will the governor speak today? Have we gotten that information yet?
There's a press conference on now.
Oh, it looks like there may be a press conference on now. I don't know if it's going to be the governor, so I'm probably going to get off and right now so y'all can flip to that. In fact, let's go ahead and do that because actually I'm running a little over time anyways. We'll try to respond to you as best we can. Thank y'all so much. Hope y'all have a wonderful weekend. You can turn into your local news station to hear the press conference. We're also very excited to hear what the governor has to say today as well. So y'all have a great weekend. Stay healthy, stay safe, and we'll see you on Tuesday.